So in this week's update from IHME on COVID around the world and our forecasts out to March 1st, there's a number of emerging patterns that we're seeing. So the transmission for COVID is rising quite rapidly in 5 groups of countries or states. First, in South America, we're seeing increases in Bolivia, Chile, and Colombia. Chile is the most notable, and so that's one area. The rest of South America, things are coming down. Then we're seeing a cluster of countries in the Middle East, from Algeria, Egypt, Jordan, and Lebanon, where transmission is back on the increasing again. And then a third area is in Laos and Vietnam, where transmission is back increasing after it had come down because of lockdowns that had been imposed. But the truly dramatic increases right now that are unfolding are in select US states like Michigan, where numbers are going up, and a number of other northern states. And then the most dramatic is in Europe. And interestingly, the countries with the biggest increases are the Netherlands, Austria, Germany, Norway, and then Czechia, Poland, and Slovakia. So what's happening? In the Northern Hemisphere, where the increases are unfolding, what we believe is this is the expected increase due to winter, but it's more intense in the places that paradoxically have done a better job during the pandemic and have lower levels of natural immunity. It's hard to explain the north-south gradient otherwise. And then in Europe, there's a very sharp east-west gradient where countries like Bulgaria, Romania, Belarus, the Baltic states, the Russian Federation, transmission is decreasing. And yet these are the places with the lowest vaccination rates, but have dramatically high levels of past infection. So trying to put all the pieces together, what we think we're observing is the combination of winter, the level of past infection, and then waning immunity from vaccine-derived immunity. This may suggest that when you take all the studies on waning vaccine-derived immunity into account, that the winter surges in the rest of Europe, the rest of the Northern Hemisphere, may be larger than we currently predict and larger than most people expect, because there is this cohort of people that were vaccinated more than 6 months ago, particularly the most vulnerable. And so this is really something that we are watching very closely, and we should be, there's a real potential risk of a worse winter than perhaps we've been expecting. The other things to note in terms of the forecasts is that at least in our current version of the model, we expect that numbers will increase, but not dramatically at the global level through till about mid-January, and then perhaps start to go down again. Now, big caveat on those, because we don't yet include in our model explicitly the waning of immunity from vaccination or from natural infection, but we are transitioning to a model that will include that. We hope that will go into public release in the early December. The testing around that model does imply that waning immunity is a big issue, particularly for those places that have historically had high infection fatality rates and high death rates. So we will need to understand what are the strategies that different countries can deploy to address, what may be a bigger winter surge than we expect. And the three main strategies, of course, will be trying to vaccinate the hesitant, encourage mask use, because we know that works and is the fastest way to try to get a handle on these surges. And then in places that have the available supplies, consider a third dose for vaccination, because that has been shown to bring immunity, at least for preventing infection, back up and could have an effect on the Northern Hemisphere winter surges. That's a more complex issue at the global scale, because there is still a shortage globally and a real concern about low vaccination rates in some of the low-income world. So there is a trade-off at the global scale. But from the perspective of controlling the winter surge, where we think most death is going to occur in the Northern Hemisphere in the next 4 months, that third dose may turn out to be critical.